an electronic patient record is probably going to be the biggest single transformational thing that we do, and it will affect everything in a really positive way. I think often people think of an EPR as just an IT system, and of course it is that, and it's something that's incredibly advanced, but most of all this is going to completely transform everything that we do, how we do it. And what I really like, and I think is really exciting, is that our EPR will also give patients much more information about their care, so they become true partners in care, and for certain things they also will manage their own care, and I think that is going to be fantastic.
It's an exciting time for University Hospitals Plymouth NHS Trust as we embark on one of the biggest transformation projects in our history. Introducing an electronic patient record will lead to a safer and more efficient hospital by bringing together all our patients' details in one place, allowing quick access for clinicians, improving efficiency and reducing the chance of errors.
I think the challenge of patient flow is so complex. So every day we make decisions around people having operations, coming to clinic, having chemotherapy treatments, for example, having their bloods taken, people coming in through ambulances and helicopters through the emergency pathways, and therefore we have multiple points of data entry for patient records. Being able to look at all of those things combined in one place will make a huge difference to people's lives and the way that we do our jobs.
The EPR is being co-designed by clinical staff, including doctors, nurses, pharmacists and allied health professionals, to make sure that it meets the needs of those using it and brings real benefits for their patients. 4 key members of the EPR team are drawn from our clinical teams, and their role on the programme is crucial. The digital clinical team, known around the Trust as the CXIOs, provide a bridge between the clinical requirements and the technical possibility.
The IT here at Derriford is really important to allow us to provide care to our patients. So I started off my journey in radiology IT systems, trying to improve those, and by doing that we've improved care to the patients in imaging, and I saw that there was a need to do that for our patients more widely. So I became interested in the hospital IT systems, of which there are many. They don't link well together. They don't make it easy for patients' care to be fluid. Patients have to describe their problems again and again, which is frustrating for them, and it's inefficient for staff, and it's not safe. So what we'd like to do is to bring things into a much more coherent and cohesive data place, so that people can explain their problems once, the information can be used multiple times, and it makes it easier for teams of healthcare staff of all varieties to bring a multidisciplinary team approach to efficient and safe care.
Having one system which I can access at any point in time, and also in an emergency to have the information at my fingertips when I need it, is going to be such a change from what I have to do now, which is investigate information in multiple systems, which is very time consuming, and sometimes we can miss information in this system. So I'm really looking forward to having one system where I can find everything I need.
What it means for us as clinicians, no matter what type of clinician you are, is that you're going to be able to put your patient first. So really the IT systems that will come in with the EPR are there to support your clinical work, not the other way round. So this means that when we go into our clinical systems that we have at the moment, our IT systems that support us currently, there are many disparate systems. We have to log on, log off many times onto different systems, and that creates more of a workload for us and takes us away from the patients. What I'm really hoping in the future, because we'll have a single system with all the information in one place, is that you'll be able to see all that information with your patient at that present time without having to leave their bedside, and the patients will also be able to have interaction with that system as well.
So speaking as myself as a physiotherapist, I did junior rotations, so I moved around different organisations and understood how they operated, and that being able to have an electronic patient record that really supports that will absolutely help our recruitment. But also we know that people get really frustrated with the way that we deal with our systems at the moment, and so being able to have the different offer for them around that connected care, that means they can be released to care for patients rather than administrative tasks that hold their time at the moment, will be really exciting for us.
We're clear that introducing an electronic patient record will transform our entire way of working, getting the right care to the right people at the right time, whilst releasing time to care. Our patients will only have to tell their story once, rather than being asked for the same information at every point in their care journey. And in turn, these changes will allow our patients to engage with their care much better and strengthen the partnership between them and clinical services.
I was probably a senior nurse in intensive care when we first started talking about electronic patient records. And I remember being on one of the first electronic patient records groups. I won't say how old I was then, but actually it will be amazing to see it come to fruition in Derriford.
The EPR programme is really, really exciting. It's been on a long old journey, probably about the last 6 or 7 years. We've been trying to secure the funding because we know it will be so transformational, and that is brilliant that we've got to this stage. But the really, really important thing, you know, again, is that this is about a whole programme of change and a great opportunity for us to co-produce it with all of our staff colleagues. So everyone needs to get involved. We need your input. You know how services work. We've got to get all of that right, and then we've got that really lovely glide path before we switch everything on. Undoubtedly there'll be a few bumps in the road along the way, but actually the potential is fantastic. And so I'm really excited about leading the Trust at this stage alongside all the other developments that we have got. But actually, it's just going to be amazing.